Good morning, everybody. Yeah, I wish I were Ryan Adams, too. I apologize that I'm not going to sing beautiful songs to you this morning. So I want to, before anything else, I love hearing how engaged your state health director is with social media, and I want to encourage you guys to talk along with me today. Our Twitter handle is @CradleCincy with a Y, and one of the reasons I say this at the start of every talk is so that if I see people in their phones, I don't feel really bad like they're ignoring me. I'm certain they are talking with me on Twitter. So please do that. We would love that. And I already tweeted out some stuff that I'm going to be talking about today. So for more information on some of that, feel free to go there. So I'm going to start in kind of an odd place. In 1892, not where you expected me to start, right? There was a horrendous fire about a half mile from here in downtown Indianapolis. If you know where the Rock Bottom Brewery is today, this is the site of this fire. One of the worst fires in Indiana history, the deadliest fire for firefighters in Indianapolis history. And the reason I want to talk about this is I think understanding firefighting in the 19th century is actually really relevant for understanding infant mortality work in the 21st century. So a big part of the reason for this fire, and fires in Cincinnati and fires all around the country in the 19th century, was the way that firefighting worked at the time. So it was very different from it is today. There were competing privatized fire companies who only got paid if they put out the fire. So this sounds like an okay idea, right? What it looked like in practice is folks would show up to the scene of the fire. Fire company A shows up, fire company B shows up, fire company C shows up, and they're all incentivized to put out this fire. So what they have to do first is beat the living crap out of the other two firefighter companies who showed up and get them to be laying on the ground bloodied and then put the fire out. This is literally what happened. People were wrestling, were brawling in front of burning buildings. And while people were in danger inside, these competing fire organizations were wrestling with each other out front. And this is one of the things that happened during a lot of these big fires in the 19th century. Another thing that happened was really poor communication between these competing fire companies. Because they saw each other as competitors, they didn't talk with each other. And that was a big part of the reason for 13 firefighter deaths back in 1892. If these groups had been talking to each other, this building would not have collapsed in on these 13 firefighters. They wouldn't have died. And I think this is highly relevant. I see in the infant mortality space, at least in Ohio, maybe you guys are much better at this here, but at least in Ohio, I see all the time organizations fighting with each other in front of burning buildings. I see them bragging about their individual programs, trying to get money to come their way versus thinking about the whole system, versus thinking about how do we actually improve infant mortality. But what I want to encourage you guys in is Indiana did not waste this crisis. After this huge fire, there was an enormous public outcry, and things started to change. Things started to shift. Here and in other parts of the country, fire departments became public, became working together and began to communicate in better ways. And we really shifted from this, hey, let's put out every burning fire, to how do we prevent fires? How do we put into law regulation that requires there be fire exits, that requires there be sprinkler systems, that requires smoke alarms in every building? And these were not easy things. We take them for granted now. We take for granted the fact that if there's a fire in this room, there's enough exits for us all to get out, and there's sprinkler systems that will come out. There were people who hated those changes when they came along. There were big interests fighting against those things. But these were systematic changes that got put into place in Indiana after that. Put simply, working alone, competing fire companies only had incentive to consider the best way to put out a fire. Working together, there was suddenly someone who could ask, what if there were fewer fires? And that's our job here today. What if there were fewer fires? What if there were fewer infant deaths? What if we asked that question more often than we ask the question, hey, how does my program succeed? How do I get ahead? And not to put too fine a point on it, there is a fire alarm going off in this community. Dr. Adams just spoke about these really striking numbers. There is big reason to be immediately concerned and feel a great sense of urgency. And I know that's part of the reason you guys are here. But we need to spread this word throughout all of Indiana. So what if there were fewer fires? How do we work better with each other? Fact one, everybody in this room, I would say, cares deeply about this problem. You don't show up at an all-day meeting on a Monday if you don't care deeply about this problem and you want to work really hard to solve it. That means if you have someone in this room who you can't stand, who just every time they speak about this issue, you think, oh, they're just fighting for their own stuff, and I hate the thing they did 15 years ago. Guess what? They care deeply about this problem, I promise. Fact 2, poor population level outcomes tell us that there is room for every single program in this state to improve. So the best performing, the most lauded program is not good enough. And if you feel like you're running the most lauded program, think about not lauding it further, but think about how you get even better, how you improve. Fact 3, we're stronger if we work together. And that's a big part of what I want to talk about today. So we use this model at Cradle Cincinnati called collective impact, which is this buzzword in the nonprofit space, and I hate buzzwords, so I apologize. I'm going to touch on it very briefly. We found it to be a really helpful frame, and if you're interested in more about it, we tweeted out about a half hour ago more information about collective impact that you can look into. So what I want to mainly hit on today is it's not simply collaboration. People hear this collective impact term and they just think, I get it, working together, let's move on. I know how to work together. Collaboration looks like fighting for a shared program. Hey, we love home visitation, you love home visitation, let's go tell the governor how much we love home visitation. That's what collaboration looks like. Working to prove what we do works. Let me show you all the great literature that shows how home visitation makes an impact on birth outcomes. Advocating for ideas that come from a shared worldview. So if you get in these rooms that are echo chambers, if you get in these rooms where everyone in the room passionately agrees with you, that's great, you can do some of that, but that's probably not the way to make change with those who don't passionately agree with you or even passionately disagree with you. I try to talk to folks all the time who really think the safe sleep message is a bad one. I try to go to them and say, hey, help me make it better. How do we get there together? Collective impact looks like fighting for a shared outcome. So if you go around talking about your program's infant mortality rate, you're doing a disservice to the concept of infant mortality. Your program does not have an infant mortality rate. Your community has an infant mortality rate. And if your community's infant mortality rate is improving, fantastic. That's what you want. You probably have to be working with other programs to get there. Working to measurably improve our work. And what this requires is immense amounts of data infrastructure, which is really boring and not exciting stuff. And nobody goes to the polls to vote for data infrastructure. But I'd say one message to your state leaders, one message to your State Department of Health is help us get better and better about data infrastructure. When I came in to my job, I said, okay, great, you hired me to solve infant mortality. What's the infant mortality rate? And they said, well, 4 years ago, it was this. And I said, oh, fantastic. What is it now? They said, oh, we don't know. And I said, well, great. Maybe we already solved it. You don't have to hire me. I can quit. Maybe it's already fixed. Today, we have real-time data about our infant mortality rate. I can tell you how many babies died 2 weeks ago in Cincinnati. And what this does is it allows us to make real-time changes. It allows us to say, hey, that communications campaign worked. That one didn't work. That new hiring of community health workers worked. Or it's not working yet. We need to give it more time, or we need to shift it, or we need to make sure they're getting to women earlier in pregnancy. And finally, advocating for what data tells us matters and tells us works. This is why we need that data infrastructure, because that's the only stuff that we should be advocating for and caring about. So what collaboration looks like often is this. A lot of folks rowing in a race. They don't know where the finish line is. There's no way of measuring or telling who's in the lead, and inevitably someone is shouting, hey, I'm doing it best. Oftentimes many of these folks are shouting, I'm doing it best. Collective impact, the idea is we're number one. We're in this together, we're headed towards a common destination, and we're all doing this really well. Due to the collective work of hundreds of people, literally hundreds if not thousands of people, infant mortality's dropped by 13% in Hamilton County over the past few years, and sleep-related deaths that we've focused really highly on have fallen by 25%. And there is some information out in the lobby about exactly how we did that, particularly around the sleep-related death stuff. I also tweeted out our sleep-related death report that has a lot of our interventions in it. The short-term answer, the quick answer is partnerships. Lots and lots of partnerships, lots of very non-traditional partnerships. We get folks involved in this fight who would traditionally never be involved in this fight. Cradle Cincinnati's main role in that change was to point hundreds of people in the right direction. We are, in general, not the doers. We don't deserve a lot of credit for this. We just say, hey, that way, and we use data to do that. So that's your job. Your job is to point people in the right direction, to be a cartographer, to give them a map. This is what I want to spend the rest of our time talking about. What does that look like? What does it look like to give the entire state of Indiana a map on how to solve our infant mortality crisis? And I love maps. Maps give you new information. This is one of my favorite maps because it really changes the way I think about my life. It really changes the way I think about the world. What does it mean for me if more than half the people on Earth live inside that white circle? What does that mean? How does that change the way I think about things? How does that change the way I think about daily life? So when I first saw that map, I haven't really been the same guy since, and it's just from looking at one simple new piece of information in a new way. And I think we have the opportunity to do that around infant mortality in a whole number of ways. So we're going to talk about 5 cartography rules. Number 1, purpose and audience are central to map making. Number 2, useful maps are extremely simple versions of immense amounts of data. Number 3, a good map uses the right scale. Number 4, stories were the first maps. And finally, people never open a map if they don't care about the destination. So let's start with purpose and audience are central to map making. This is a real map that was created by a gentleman who lives in the Boylan Heights neighborhood of Raleigh, North Carolina. And this is a map that is incredibly useful for a particular audience and completely useless for everyone else who looks at it. The only audience that cares about this map is squirrels. This is a map of squirrel highways in the Boylan Heights neighborhood. This guy literally walked through his streets and mapped out every telephone pole, every tree branch that could allow a squirrel to get across this neighborhood without touching the ground. So it really matters who your audience is when you create a map. I don't find that map terribly useful. A squirrel would find it tremendously useful and would say, finally, a map. So in order to create a map, you have to know your audience, and you have to know your audience's purpose. People don't buy what you do, they buy why you do it. They buy why you do it. And this is a very simple map of our brains. The very center of our brains is where we make decisions. And this decision-making portion of our brain is only concerned about motivation. Only. Solely concerned about the why you do things. Outside of that layer is a layer that's concerned about how we get there. Outside of that is what. But yet we often approach people with the what. What is it that we want them to do? What is it that we're talking about? Lots of facts and figures. To give you an example of what this looks like in advertising, for years and years, you remember old PC commercials, Dell, Gateway, et cetera. Those folks would come at you and they'd say, hey, here's how much RAM this computer has, here's how many gigabytes of storage it has, here's how big the screen is, here's what the keyboard looks like. And you were supposed to sort of compare all these notes and say, okay, I want the one with the most RAM and the most gigabytes for the least price, and you didn't know what RAM meant, and you didn't know what gigabytes meant, and so you just sort of looked at this and said, okay, I guess I'll go with this one. What Apple did is they came along with a totally different model. They said, you are a poet. You are a singer. You are a surfer on the weekends. You take beautiful pictures of handsome men on exotic islands. Apple. That was it. They said nothing about their computers. They did absolutely nothing. I have no idea how much RAM my Apple computer has. I just know that I'm a poet, and I like to surf on the weekends, dang it. Neither one of those things is true, but I love to believe it about myself. So this idea of really grabbing people by their identity is really important when we think about map making. Oh, there we go. So one way we do this with Cradle Cincinnati, we have a group called the Cradle Cincinnati Learning Collaborative. And let me tell you what this group is. It is 130 individuals representing 28 different prenatal care teams. It is essentially every provider of Medicaid prenatal care in Hamilton County, Ohio, all working together to improve care. And so these 28 teams have a really specific what. Their what is they have 12 data points that they're trying to improve about their care process. They have a really specific how, and that is we bring folks called quality improvement consultants into their healthcare centers to try to improve those data points. Both of those things are great, and they're actually what we're doing. And they do not care. Anytime I talk about those two things, they go to sleep, like you have just done. You're like, okay, data points, great. They care about why. they care about the fact that they have, for 20 years, shown up in really difficult healthcare environments and combated this problem. And finally, somebody cares about their voice. Finally, somebody wants to hear what their solutions are for this problem. And if you approach them from that lens and just say, after we've talked about the why, let's get to some of this how and what, we've been much more successful. So we also try to know the audience that we're serving. And one way that I wanted to share that we're thinking about this is looking at kind of 3 risk factors for infant mortality. Any mom who's being served by Medicaid, we know they're at increased risk. Any mom who is African American, regardless of socioeconomic status, in Hamilton County, an African American mom who has her master's degree is more likely to lose her baby than a white mom who has not graduated from high school. So regardless of socioeconomic status. And 3, any mom who's had a previous preterm birth, regardless of socioeconomic status, regardless of race. So what this looks like, we try to map this system. In Hamilton County, we have 11,000 births every year. This is strikingly consistent. About 3,700 of them are African American every year. About 4,600 of them are on Medicaid, and of course there's some overlap there. And about 670 of them have had previously preterm births. So we start to better understand, okay, who's at risk here? What does this look like? And then we put infant mortality rates on top of that. So you'll notice right in the center of that, with that triple risk, is the highest infant mortality rate. Over the past 5 years, 25 out of every 1,000 babies die with that triple risk. And you can start to look at some of those other categories, and it starts to get to some really interesting questions. One thing I'll point out is that the African American moms not served by Medicaid have a worse infant mortality rate than the African American moms served by Medicaid. What does this say about our system? Where might holes be that we haven't previously understood them? And so really mapping out who it is that you're trying to serve, and then starting to ask why about each one of those populations can be really helpful. So purpose and audience, central to this stuff. Number 2, useful maps are extremely simple versions of immense amounts of data. This is a map of the subway system in Washington, D.C. And what I like to say about this map is a lie. This is actually not what the subway system looks like. The lines are not that straight. The stations are not that evenly spaced apart. I think the entire above-ground infrastructure of Washington, D.C. is represented by 4 monuments on here. Guess what? It's a lot more complicated than that. The river is not that straight. This map is a lie. It's just a really useful lie. It's a really helpful lie. It omits a lot of information that we don't need. And in fact, there's this rule of 7 I love to talk about. Back in the 1940s, psychologists discovered that we humans are only capable of keeping 7 pieces of information in our brain at a time. That's basically our short-term memory capacity. And this information came out at the exact same time that people were getting home telephone numbers. And it's the reason our home telephone numbers are 7 digits long. It's what we're able to memorize. It's the reason when someone gives you their telephone number with the area code, you have to run to a piece of paper because you cannot remember it correctly. 7 pieces of information. So what this means for us in infant mortality is if you are trying to tell somebody more than 7 things about infant mortality, stop. This is all they are going to retain. And I would argue that, in fact, 7 is probably too high. So this is an example of a map. I would argue a really poor map of infant mortality. Infant mortality is incredibly complex, as everybody in this room understands. And there are dozens and dozens of factors. We need to understand that internally, but when we're talking to folks that we're trying to give a map to, we do not need them to understand that. They're going to look at this and say, wow, this is really boring. I'm moving on. What we do at Cradle Cincinnati is we say, infant mortality is a complex problem, but we've discovered through data that there are 3 main drivers of it in Hamilton County: spacing, smoking, and sleep. They happen to all start with S, which makes it even easier to remember. And I talk folks through the fact that if you have more than 12 months between your pregnancies, you're less likely to have a preterm birth. And in fact, this is the #1 driver of infant death in our community. Maternal smoking is a huge problem, and it's not a problem of education. It's a problem of resources and capacity. Women are not even being asked if they smoke at their prenatal care appointments in many cases. We've given up on this issue, and we need to stop giving up on it. This is a huge driver. It costs us money. It costs us lives, and we need to care more about it. And safe sleep. Every baby needs to be put to sleep alone on their back and in a crib. I have said those couple of sentences probably 10,000 times in the past 3 years. And the good thing about saying spacing, smoking, and sleep is that years later, the mayor of Cincinnati came to me and said, spacing, smoking, and sleep, right? And I said, yes. Years later, the CEO of the Children's Hospital in Cincinnati said spacing, smoking, and sleep. And I said, fantastic, love it. This is a spreadable message because it's simple. That other message on the other side of the screen there, that is not something they would have repeated to me. In fact, they probably would have forgotten the meeting. So in order to get there, you have to say no far more than you say yes. You have to say no to things that you love, ideas that you love. You have to say, is that part of this problem or not? Is that a driving force behind this problem or not? If not, then I have to move on. I really have to focus on these three things that I've said I'm going to focus on. And spacing, smoking, and sleep are all enormous problems that would take millions of dollars and a generation to improve. And so we cannot try to build 17 other things on it because we're afraid to say no. A good map uses the right scale. So let's say we wanted to get to the Grand Canyon from Indianapolis. This would be a really bad map for that. That's not going to help us get there. And this would be an even worse one. This is our galaxy within the supercluster that we exist in the universe, if that gives you some perspective on your Monday morning. This would be an okay one. This starts to get us at least most of the way there. If you know generally where the Grand Canyon is in northern Arizona, you could probably get there and use signs to get you the rest of the way there. So that's a pretty good sign. On the other end of the kind of universe scale, this would be a bad map to get there as well. Zeroed in on the Grand Canyon that just sort of says, hey, here's a map of the Grand Canyon. Does that help you get there? No, it doesn't. But yet all the time in infant mortality, we have these problems of huge scale and tiny scale that we go into. And here's what that looks like for me. I'm in a lot of conversations where folks are trying to solve poverty. They've got 8 people in a room. They have a budget of $0. And they're like, you know what we're going to do? We're going to solve poverty. You're not. You're not. These are incredibly important contextual parts of our conversation and parts of our work. If there are large-scale poverty initiatives going on in your state, in your city, in your community, absolutely sit at the table, absolutely be a part of them. But we cannot spend all of our time focused on the really macro-level issues. On the other side, I've been part of conversations that have lasted an hour and a half about what kind of font is going to be on the flyer that we're going to send out. And this cannot be, this kind of micro-level conversation cannot be our focus either. We've got to find some middle ground, but yet I've spent a lot of time in both of those other rooms. So I like this. This is helpful to me, that you have a sphere of control, you have a sphere of influence, and you have a sphere of aspiration. So to talk about sphere of control real briefly, on the issue of spacing, we have a reproductive life plan that we use that looks like no other reproductive life plan in the country. It looks like a journal. It looks like something that mom would actually want to take home and keep and engage with. It asks her questions about her life. It asks her questions about her dreams. It shares other stories of women like her who have changed their lives and changed their situation. And this is something that we can do within our sphere of influence, is get this out to moms and really engage them within our sphere of control. Within our sphere of influence, we have the ability to say, hey, spacing is an issue, and spread that issue around community leaders in our community and start having conversations about what we might do around that. Among our sphere of aspiration, one day I would certainly love for every child in Hamilton County, Ohio, to get really comprehensive reproductive health education in school. It's not going to happen right now. It's not going to happen right now. And I need to keep that right now in my sphere of aspirations. If I spend all my time working on that, then I'm going to be fighting against the ocean. And so I need to keep my eye on that. I need to understand when the tide changes. But right now, it needs to stay in that sphere of aspiration. Stories were the first maps. Before we ever had written maps, before we ever had map making, anthropologists tell us that the way people knew how to get places was storytelling. Go down to the tree where your uncle died 3 years ago. Turn right. Go to the field where we had the war that your grandpa fought in 45 years ago. And then go to the rock that looks like it was thrown out of the sky by a god. And that's where the source of water is. This was how we mapped out our world, was through storytelling. Story isn't a way we make sense of the world. It is the way we make sense of the world. We don't share facts and figures. We share stories. Data must be part of a larger story. Have a beginning, middle, and end. Have characters, have motivations, have a climax, have a clear resolution, have an enemy. These are the components of storytelling. Invite the audience in by using their curiosity and making them a character in the story. So one way we do this is almost every time I speak, I hand out stationery at the end of my speech. And I say, right now, In Hamilton County, there is a woman who is pregnant and frightened, and she does not have the social support she needs to get through this pregnancy. I want you to write her a letter. We're going to give it to her at her next prenatal care appointment. I want you to sit down, put pen to paper, and say, you are strong enough for this. You are good enough for this. I want you to share a personal story of when you've overcome something that's difficult. If you had a difficult pregnancy, I want you to share that story. And you are going to help fight infant mortality right now, right today. I've done this with business leaders. I've done this with political leaders. I've done this with folks who think, this is great. This is a big problem. What the heck could I do about it? This is a way of inviting them into this story, making them a character in this story. Infant mortality is an issue that we really love to push aside and other. We love to say, oh, that's them. That's their problem. This disallows that. You're invited into that story. And as a side note, the women we give these letters to really, really love them and respond really well to them. We know that social support, we know that stress makes a difference in pregnancy. This is an easy way to come alongside that. People only spread stories worth sharing. So we issue a data report every year, which is the most boring thing we do. There are hundreds of data reports issued on birth outcomes across the country every year. What they usually look like is a spreadsheet printed out of a computer. And we said, what if we did this differently? And ours looks like stories of families, stories behind the data, beautiful, full-color, glossy photos that really engage the audience. And as a result, we try to use language that is understandable. We don't use acronyms. We don't talk over people's heads. And as a result, our data report last year was shared 11,000 times by people. And this is something that is not true, I would venture to guess. And that's available, again, tweeted that out just a few minutes ago. There's also hard copies of it out in the lobby if you want to take a look at that. Something else we think, so what does sharing look like? What will participants talk about when they get home? What about this experience is worth tweeting about, is worth taking your phone out to take a photo of, is worth copying? Avoid anything that looks like government. I used to work for government. I'm allowed to say this, I promise. I apologize, Dr. Adams. You have seen IRS tax forms. Do not make an IRS tax form of whatever it is that you're working on. Make the TurboTax version. Make the version people want to engage in. Make the version that makes sense. I have friends who own a business, and their no parking sign in their parking lot says, do not park here overnight or we will tow your butt. And that's very different from, that gets the message across to me versus the sort of fine print, Ohio subsection code 87492 says we're going to tow your car. No, we're going to tow your butt, sorry. So something we do that we think is worth sharing. Prenatal care is not engaged to the degree it should be in Hamilton County. There are lots of reasons for that. One reason we think is prenatal care for women in poverty in Hamilton County doesn't always look like a great experience, doesn't feel terribly welcoming. It feels like the IRS tax form of a building. So we've gone in and tried to make it feel like the TurboTax version of a building. We've brought, with very little investment of resources, hundreds of volunteers, designers, artists, architects, dozens of businesses have come in and given pro bono work, and we transform these spaces to make them feel more welcoming. And the idea here is we want them to feel like spaces that are worth sharing. We want women to come into prenatal care and say, man, when I got my exam, it said, you are always our queen on the wall. If you are pregnant, you've got to go to that health center. We want word to spread about what these prenatal care centers look like and feel like. This is a WIC office where women are learning to breastfeed. We want that to feel private and comforting and engaging. We want women to know that you are loved by your community. We want them to feel that. We've done this at 2 health centers, and we're starting our 3rd project next year. And we think this makes this experience something worth sharing for the women who show up. And it costs us almost nothing. If you don't tell a story, they will find someone who will. This is, if nothing else, a fact about our society right now. We all carry story machines around in our pockets. And if you're not telling folks a story, they're going to stop listening to you, I promise. Finally, people never open a map if they don't care about the destination. In Cincinnati, there is a burger joint that has a big sign on the wall that says, 4th best burger in town. I have been to this burger joint probably 150 times in my life, and I have never had their hamburger, because I do not want the 4th best burger in town. I want the best burger in town, right? People are hungry for a vision and will follow someone with a compelling one. They want the best burger in town. They want to hear about your compelling vision. They want to run after that. How will this work have generational impact? Whatever you think your why is right now, it's not big enough. Even if it's saving lives, it can be bigger than that. It can be saving lives so that those lives go on to save lives, so that those lives go on to save lives. The work you all are doing in this room has enormous potential, and you need to talk about it in those terms. We have a ridiculous goal at Cradle Cincinnati. Our infant mortality rate stated goal is 0.0. This is absurd. I have no idea how to do this. Babies are born with congenital anomalies that science doesn't know how to solve every year. Babies are intentionally killed every year by their parents in Hamilton County. There are real deaths that I do not know how to solve, but this is the only goal I'm willing to wake up and fight for every day. I'm not willing to put hours and hours of work into something that says, I still am okay with babies dying. And I think that's true for all of our partners as well. We need to give them long-term, huge visions. Do we have shorter-term goals? Absolutely. But the goal we talk about all the time is this. Every baby born in Hamilton County is going to live to see their first birthday. I believe it's possible someday. I believe we're part of probably a multi-generational fight to get there. So I want to touch really briefly on funding, because folks always ask me about this. We turned a $250,000 grant into $12 million over the past 3 years. We have 24 funders. We have had essentially no one tell us no, because we're really persistent. We talk in big terms. We talk in terms of hard data. And we fight and fight and fight for these dollars. I believe this is possible in any community. I believe it's possible to take a small initial seed grant and really drive change around this. So let me give you just some real quick keys to funding success. I'll gladly talk with anyone one-on-one after this about this. Strong, prominent community figure leading the charge. We have a Hamilton County Commissioner who's been an elected official for 20 years, who chairs our work and who has opened a lot of doors for us. This is possible in your community. I used to work for the mayor of Cincinnati, and what I know about elected officials is they are hungry for issues to work on, and they are hungry to make change. They want you to come to them and say, would you be the face of this? They want you to come to them and they want to help you make change. A lot of folks go into business because they want to make money. Folks in general, regardless of how you feel about elected officials, folks in general become elected because they want to make a difference, and you have the ability to power that and to help them make a difference. Identify an early adopter who can push other funders. UC Health gave us that initial $250,000 grant. It gave us the ability to go to other hospital systems in Hamilton County and say, they gave $250, what are you going to do? And they really hate each other, the hospitals. And so they said, well, I'm going to give $300. Okay, great, fantastic. And we used them against each other in beautiful ways. Engage potential funders in the process before asking for money. We did a year-long strategic planning process with all of our funders before we asked them for a dime. We told them at the start of that year, we are going to ask you for a lot of money at the end of this year. And they said, okay, yeah, just work with us through the process. And we had them bought in by the end. Organize around a common data-focused agenda. Funders love it when you actually are proving that you're making change. What number are you trying to move? And have a simple message that can engage organizational leaders with limited bandwidth, which we talked about. So what if there were fewer fires? What if fewer babies died in Indiana? This is the question for the rest of the day. And I want to put a challenge to you guys. There are 6,619,700 people in the state of Indiana. The rounding error, the 700 part of that, are in this room. So your job is to reach the other 6,619,000. That's about 10,000 goal per person in this room. You got to reach 10,000 people. They want to care about this issue. They don't know it yet. They're afraid of it. They don't want to think about sad things for a long period of time. They don't want to think about complex things. They don't want to ask questions that are going to push their identity, but they do want to engage in it. There is no bigger instinct that we have than to love and protect the children of our own and the children in our community. And that is something we have the power to leverage, and you guys in this room have the power to show everyone else in this state the way. Thank you, guys.
Well done. Have a seat. Good morning, everyone. Just to introduce myself, I'm Dr. John Warner. I'm the Secretary of the Family and Social Services Administration, which is a large mega agency that does a lot of funding of social benefit programs. It's my pleasure to be one of the moderators today and to ask some questions. Ryan, thank you very much for your presentation and your passion and leadership on this issue. You know, it's great that Cincinnati's so close because there's a lot of synergies between Ohio and Indiana. But with our theme of collaboration, you spoke pretty clearly about collective impact and the county and regional partnerships that you sought. What was the outreach like to faith-based organizations? And also, could you speak to your relationship with state agencies?
It's a great question. So we have lots of non-traditional partners at our table. Our table of collective impact looks like every maternity hospital in Cincinnati. It looks like the children's hospitals, some of the foundations, a lot of the sort of usual suspects. But then we layer on top of that members of the community, members of the faith-based community, high school principals, and lots of folks who, police officers, who maybe normally wouldn't be involved in this. So our partnership with the faith-based community looks like we have a network of 30 African-American churches in Cincinnati that we partner with. Just this past weekend, we were at all 30 churches with safe sleep demonstrations, with cribs showing families how to put their babies down to sleep. Again, we found folks really want to engage in this issue once we approach them. We have a whole section of our website, cradlecincinnati.org, that talks about our faith-based partnerships. We have videos that we've filmed talking about families who've lost babies that we encourage folks in the churches to use. We give pastors talking points that include biblical references that they can engage with this issue around. And just like any other audience, we try to meet that audience where they are. In terms of the state of Ohio, love that question. And you guys have the opportunity to talk to state leaders from Indiana here today. I think the biggest thing we are working on with the state of Ohio and continue to work on, but would love to continue to push them on, is just lots and lots of open communication and involvement in the planning process. I think this issue is one that is really inherently local, and if the state leaders want to do service to it, they need to invite those local leaders early on in the process. So if you're putting together a statewide campaign, if you're putting together statewide events, really getting lots of engagement around that. And just to give you one example on that, the state of Ohio a couple years ago did their own safe sleep campaign and didn't tell us about it ahead of time. And they threw billboards up at the same time that our billboards were up with different messaging and different phone numbers. And this year we have a good enough relationship that, in fact, we're coordinating those efforts together, and we're going to have the same message, and we're going to have, when they might be up in November and we'll be up in December, and we'll sort of increase our impact rather than compete with each other.
Outstanding. Well, and you mentioned, there's so much redundancy in the system. Could you speak a little bit more about turning the direction from I'm number one to we're number one, and then how did you specifically get some folks to give up the programs that they had a real investment in?
It's the work every day, for sure. I mean, there is a definite instinct in us to want the programs, especially if we've been working on programs for 20 or 30 years. We want them to stand out. We want them to be the answer. I think the best way to it has been sharing lots of data with organizations and getting folks to bring to the table some of their data. So to give you one quick example, in Hamilton County, we have 13 social service agencies who provide some version of either community health worker visits or home visitation. And those 13 agencies were always fighting for resources. We brought them all together and we said, well, let's find out, let's just ask a really basic question. How many people did we collectively serve last year? And we know that there are 4,500 women who give birth every year in Hamilton County who live in poverty. And collectively, those agencies served 900 of them. So this really changed the conversation. Hey, we're only getting to 20% of the women. Let's stop fighting over those 20%. Let's stop wrestling in front of the fire. How do we get to the other 80%? If you're doing a great job with your little slice of the pie, your job needs to become mostly about growing that slice of the pie. How do you serve more women next year? How do you serve them earlier and better?
Not to get too far in the weeds on data, but you're dealing with all these various organizations that accumulate various data. How did you go about getting them to share that data? Were there, particularly with state and even federal agencies, there's MOUs and various contracts that have to be arranged. Was this something that your team was able to facilitate?
It was. So there's an enormous amount of legal infrastructure that goes into this, and exactly what you talked about, getting MOUs signed. but it's important enough, and there are sort of like little bites at it that you can start to do, like the one I just talked about, that don't require that kind of stuff, that just require a little bit of trust. We have a great relationship with our county health department and with our state health department that allow for a lot of this data to flow through. But in terms of the programmatic level data, it's really all about building the relationship.
You spoke about the tactic of having the health systems compete to see who could up the ante. But any other tips for the group about your success in fundraising? Because that's pretty impressive what you were able to do.
I think momentum was kind of the key to it. And so we have funders who have told us legitimately they're actually not all that interested in infant mortality. They just feel like there's a lot of momentum behind our work, and they're interested in community change. And so they want to be a part of that. And so again, I think the key to that was sort of timing. So not asking for these grants and dollar amounts slowly over time, but sort of doing a year-long planning process together, and then making a series of asks all within the same couple months, so that we can make a large community-wide announcement in partnership with each other.
You used the metaphor of a fire. What was the biggest fire you prevented or put out?
I think what we're proudest of is the reduction in sleep-related deaths in Hamilton County. Again, we have detailed information on our website and out in the lobby about how we did that. But it's we've seen statistically significant change in the number and pacing of sleep-related deaths in our community. One way that we measure this is the days between a sleep-related death. And that went from an average of less than 30, so more than one a month. I think we were at an average of about every 20 days we saw a sleep-related death. Last year we had 169 days in a row without a sleep-related death. And so we've seen great change around this, and as I've mentioned, we saw a 25% drop in that. Our big next task, and by next I mean next 20 years, is how do we take that model and use it to move the much harder needle of preterm birth. And smoking and spacing are our initial ways into that door.
Final question, and it'll come up with other panelists today, but what was the most surprising, untraditional or non-traditional or unconventional partner that you found?
Yeah, lots of them that we love. So I'll talk real quickly about two that we are just launching right now. Kroger, the grocery store chain, has agreed to put safe sleep messaging in the diaper and baby food aisles for us. So large floor decals that talk about the ABCs of safe sleep and encourage folks to engage in that message. And Kroger has also, through their data analytics, they donated about 50 data analysts for a day-long hackathon where they took their proprietary grocery store data and combined it with our infant mortality data and taught us new things about correlations. So for example, the largest predictor of preterm birth is how much packaged meat you buy at a Kroger store. And they taught us all sorts of interesting things that we wouldn't have otherwise seen. The other is one we're just launching that I'm excited about. It's a partnership with the Hamilton County Library System. In the short term, they're putting a safe sleep bookmark in every book that goes out for a month or two. And in the longer term, they're actually going to use their libraries to host moms groups in high-risk neighborhoods throughout the community.
Outstanding. Well, Ryan, I tell you, it not only takes vision, but intentional leadership to be able to accomplish the things that you and your partners have done. So we thank you for your passion and your leadership. And ladies and gentlemen, Ryan Adcock.
Thank you, guys.